Shoulder surgery can be life-changing, but what if I told you that most people go into it believing flat-out lies? If you expect instant pain relief, a super fast recovery, or think you can skip physical therapy, you're in for a rude awakening. Today I'm exposing the 5 biggest lies about shoulder surgery that could seriously mess up your recovery. So let's get into it. Hello, I'm Dr. Dan Orcutt. I am an orthopedic surgeon specializing in shoulder injuries and surgery. I help people just like you navigate surgery, recovery, and rehab so you don't make the same mistakes I see every day. If you or someone you love is preparing for shoulder surgery, you need to know these 5 recovery myths, because what you don't know can hurt you. And if you find this video helpful, be sure to subscribe. Just push the subscribe button down below and we will give you more expert recovery tips. Let's start with the first and biggest myth. Many patients think that as soon as surgery is over, they'll wake up pain-free. The reality? The first few weeks after surgery are usually the most painful part, especially the first few days after the block wears off. Your body is recovering from an incision, internal stitching, anchor placement, and swelling. These all are the reasons for continued discomfort. You may feel sharp pain, tightness, or even numbness in the first 2 to 3 weeks. Think of it like remodeling a house. You don't instantly have a brand new kitchen the moment demo day ends. There is a lot more work to do. There's dust, debris, and a whole rebuilding phase before the final result. Have you ever been told that surgery would make you pain-free overnight? Drop a comment below. I want to hear your experience. Now let's talk about recovery timelines. I can't tell you how many times a patient has asked me at their 4-week checkup, "Doc, why isn't my shoulder back to normal yet?" The truth? Real recovery takes time. What recovery really looks like. Weeks 1 through 6. Pain management, gentle movement, and sling support. We know that it takes at least 6 weeks to get some significant healing in the rotator cuff and 3 months for near complete healing. Months 3, 6 gradual return to strength, but still limited motion. Getting close to normal motion is the goal, and it takes time. Months 6 through 12. Most patients feel better, but not normal again. Strength keeps improving. Anyone who tells you that you will be as good as new and forget you ever had surgery is promising you something that they most likely cannot deliver. Some people recover faster, but comparing yourself to others is a mistake. Focus on your own progress. If you've had surgery, how long did your recovery take? Were you surprised by how long it lasted? Post your experience in the comments below. Now let's talk about physical therapy. A lot of people want to avoid physical therapy because it's uncomfortable. But skipping physical therapy after shoulder surgery is like buying a brand new car but never changing the oil. Sure, it runs at first, but over time, things start to lock up, break down, and cause bigger problems. PT is the maintenance your shoulder needs to stay functional. Why PT is essential. It prevents stiffness and frozen shoulder. It rebuilds strength so your shoulder can function well in your daily tasks. It helps reduce long-term pain and weakness. Think of your shoulder like a rusty hinge. If you don't move it, it locks up. PT keeps it moving so you don't lose function. What's the toughest physical therapy exercise you've ever done? Let me know in the comments below. Now let's bust another common myth, post-surgery pain. Even a perfect surgery doesn't mean you'll never feel pain again. Your shoulder will have good days and bad days, even months after surgery. Pain can last for up to a year, but it should gradually improve. And even after that, some discomfort may remain. If your pain gets worse instead of better, that's a red flag. You need to go see your surgeon for a reevaluation if this happens. Now let's talk about something most people don't prepare for: how hard daily life is after surgery. If you live alone or think you'll be fine by yourself, think again. The first few weeks post-op, even simple tasks are hard. If at all possible, get some help, even if it's just to get you in the shower the first time or to help with daily cooking and cleaning. Those tasks will be exhausting for the first few weeks. You'll struggle with sleeping, getting dressed, and preparing meals. Before surgery, set up pillows, button-up shirts, and meal prep. Trust me, it makes life easier. By the way, if you want to be fully prepared for your shoulder surgery, I've put together my best pre-surgery checklist. Everything you need to set yourself up for an easier recovery. Just drop the word PREP in the comments below, and I'll send it to you. To recap, here are the 5 biggest myths. Surgery equals instant pain relief? Nope. Full recovery happens in weeks, more like months. PT isn't necessary. It is 100% required. No pain after surgery. Expect pain at first and some soreness for a while. You won't need help. Trust me, you will. Which of these myths surprised you the most? Drop a comment below. I would love to hear what surprised you.